opposed to wearing one yourself?
Well, I just don't want to wear one myself. It's a recommendation. They recommend it.
Do as I say,
I'm
not as I
feeling good.
do.
I just don't want to be doing, I don't know, somehow sitting in the Oval Office behind that beautiful Resolute desk, the great Resolute desk. I think wearing a face mask as I greet
The rest of the country wants you to wear a mask,
officers,
please.
dictators, kings, queens. I don't know.
Kings.
I
What?
don't see it for myself. I just maybe I'll change my mind, but this will pass, and hopefully it'll pass very quickly. Now, with that being said, if somebody wants to, I mean, most people can just make something out of a certain material.
Out of
So
a
it's very
certain
well
material.
designated. It's very simple to do. I won't be doing it personally. It's a recommendation.
I don't want to make anything.
So, would you like to
Who would
say
cover
something
this
to that?
mug?
Sure.
Surgeon General, please.
Well, thank you, Mr. President, Mr. Vice President, Mr. Secretary, and CDC Director Redfield. I especially want to thank the folks at the CDC, and it's a great question that you ask. It's a fair question that you ask. I want to unpack the evolution of our guidance on masks because it has been confusing to the American people. First of all, I want people to understand that the CDC, the World Health Organization, my office, and most
Just say,
public health and health
this man
organizations
didn't want us to
and
tell people to wear masks because they
originally
thought people would be
recommended
afraid,
against the
and that's when
general
we said no
public
masks.
wearing masks because based on the best evidence available at the time, it was not deemed that that would have a significant impact on whether or not a healthy person wearing a mask would contract COVID-19. We have always recommended that symptomatic people wear a mask because if you're coughing, if you have a fever, if you're symptomatic, you could transmit disease to other people. What has changed in our recommendation? Well, it's important to know that we now know from recent studies that a significant portion of individuals with coronavirus lack symptoms. They're what we call asymptomatic.
Right.
And that even those who eventually become pre-symptomatic, meaning that they will develop symptoms in the future, can transmit the virus to others before they show symptoms.
Right.
This means that the virus can spread between people interacting in close proximity. For example, coughing, speaking, or sneezing, even if those people were not exhibiting symptoms. In light of this new evidence, CDC recommends and the task force recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain. These include places like grocery stores and pharmacies. We especially recommend this in areas of significant community-based transmission. It is critical, and the President mentioned this, the Vice President mentioned this. It's critical to emphasize that maintaining 6 feet of social distancing remains key to slowing the spread of the virus. But CDC is additionally advising the use of simple cloth coverings to slow the spread of the virus and to help people who may have the virus and do not know it from transmitting it to others.
I said this on somebody's
These cloth
page
face
like
coverings recommended are not
20 minutes
surgical
ago.
masks or N95 respirators. Those are critical supplies that must continue to be reserved for healthcare workers and other medical first responders as recommended by the current CDC guidance. As the President also mentioned, cloth face coverings fashioned from household items or made at home from common materials at low cost can be used as an additional voluntary public health measure. This recommendation complements and does not replace the President's coronavirus guidelines for America, 30 days to slow the spread, which remains the cornerstone of our national effort to slow the spread of the virus.
Are they told they're going to get fired if they don't say the President's plan?
Always looking at the data. We've told you that from the beginning. Dr. Burke said that every
If I was president, I'd be like, this is not my plan, this is the CDC's plan, these are the experts' plan,
and new
it's not
recommendations
my
will come
plan.
as the
I'm
evidence
just telling you to do it.
dictates. So I want to say if you do choose to wear a face mask, very important, wash your hands first because you don't want to put on a face covering with a dirty hand. Do not touch your face while you are wearing the face covering because, again, you could take materials from the surface, germs from the surface, and bring it to your face. If you choose to wear a face covering, please leave the N95 mask, the medical supplies for the medical professionals, healthcare workers, and frontline workers. Know that this is not a substitute for social distancing. And remember, this is all about me protecting you and you protecting me.
Right.
This is about us coming together as communities.
So Donald Trump doesn't want to protect anybody because he doesn't want to wear a face mask.
They're wearing it to protect
I'm not
their
going to do
neighbors
it.
from getting the coronavirus, because again, they could have asymptomatic spread.
He can set the example by
Thank you very much
wearing
for that.
the face mask,
Appreciate the
but
opportunity
he
to update.
won't because he's an ass.
Okay, John.
Mr. President, Dr. Fauci last night recommended, said that every state should have stay-at-home orders right now. Do you agree with that? Should every state in this country have the kind of stay-at-home orders that we now see in places like Washington?
I leave it up to the governors. The governors know what they're doing. They've been doing a great job.
They don't,
We're close to 90%.
because you had the governor Kemp from Georgia who didn't think that it could be spread
jeopardy. No, I would leave it to the governor.
from asymptomatic people.
I like that from the standpoint of governing, and I like that from the standpoint of even our Constitution.
I don't want to take responsibility. That's why it's the governor's fault.
The Food and Drug Administration announced yesterday.
Well, right?
Thank you,
we
Mr.
had it.
President.
I heard a different voice. I heard a much different voice. Go ahead. We'll get you later.
Going to the oil meeting previously, is the U.S. willing to cut domestic oil production? What came out of the meeting? What was the consensus?
Well, a lot of things came out. It's a great industry. It's an important industry. It's a tremendous job producing.
That came out of the meeting, really? Those three
And
things?
it's just vital.
Those four
And
things
it was
came out of the
also,
meeting?
Very interesting because they all were given the test before they came into the room.
Meaningless.
The head of Exxon
Meaningless
Mobil,
words
they've
from a
all
meaningless
taken the
man.
test, and they all passed with flying colors, so that was
Flying
good.
covers?
They left happy in that respect, at least. There's just an overabundance of oil right now, oil and gas, a tremendous overabundance, and
So?
it was caused.
That's supply and demand.
Great job. They were
If there's a big
producing a lot
supply,
of energy,
prices
but
drop.
you had the virus come along.
All y'all
It knocked another
free market
35%,
people
maybe
want to talk
30%
about
off
supply
of
and demand,
the
but then you want
market.
to
So there's too
artificially
much oil,
adjust
there's
supply because you're not making enough
and,
money.
These are great companies, and they'll figure it out. It's free market. We'll
It's
figure
not a
it
free
out.
market if you're artificially reducing
What's on the
supply.
table here with
And the
him?
Crown Prince, both.
Yeah.
They were having a competition. We'll see how it all works out. I think it's going to work out very well. It's going to take a long time to get rid of that. There's massive excess amount of oil and gas, massive.
Okay,
Like probably there's never
which means
been.
that the price drops.
So where that does work
That's how
out well, I guess. you could
Capitalism
say,
is
for
supposed to work.
drivers, I think in certain locations it's down to 90 and 95 cents a
We have it like 80
gallon
cents here some
right
places.
now on the road. But we have a tremendous industry, a great industry, a tremendously important industry.
Tremendous,
from the
it's
standpoint of
huge.
jobs.
It's a big industry.
And we're energy independent. We have to make sure we keep it that way. All right, please, go ahead.
Mr. President, as I was saying, the Food and Drug Administration, to address the shortage of blood supply, announced yesterday it would ease the restrictions on certain donors, including gay men, who are now required to be abstinent for 3 months as opposed to 12 months to donate. Did you have a hand in that change?
No, I didn't know anything about that. That was done by the FDA.
Did he have a hand in that? He has no clue.
Please,
Yes, Mr. President, both the government of Canada and 3M are pushing back on this DPA not to export N95 respirators. 3M says...
I don't blame them. They can push back if they want. We're not happy with 3M.
Yeah.
We're not happy. And the people that dealt with it directly...
I don't like 2 M's. I don't like 3
So
M's.
we'll see what
3
they
M's are
do.
just
I
too
heard
many
what he had
M's.
to say today. I don't know the gentleman, but we're not happy with 3M. Go ahead.
And where is Dr. Fauci?
I don't know, but every time you ask that question, whenever he's not here, you look, you say, where is he? And you'll say, is there a problem? No problem whatsoever. Every time he's not here, sometimes I'll ask him
There's
to
a
come because that's
reason,
the first
because
question
he's
that
the
you ought to
person
come
giving
to
us the
about
most
this
reliable information, or one of
fake
them.
news establishment
That's
and
not
asks,
you.
Where's Dr. Fauci? We're doing great together.
If I may
Except
ask.
we're covering a different subject today. Go ahead.
Different subject, if I
Go ahead,
may
Jim.
ask.
Try another
Mr.
one.
President, you have said nobody could have seen this pandemic coming. But in fact, Secretary Azar at a biodefense summit in April 2019 said, of course, the thing that people ask, what keeps you most up at night in the biodefense world? Pandemic flu, of course. I think everyone in this room probably shares that concern. Your own Health and Human Services Secretary was aware that this had potential of being a very big problem around the world, a pandemic of this nature. Who dropped the ball?
Well, I always knew that pandemics are one of the worst things could happen. There's
Sure.
been nothing like this since probably 1917. That was the big one in Europe. It started actually here and went to Europe, probably.
It's the American flu.
I've heard about, excuse me, wait a minute, let me finish. I've heard about this for a long time, pandemics. You don't want pandemics. And I don't think he was talking about a specific pandemic. He was talking about the threat of a pandemic could happen, and it could happen. Most people thought it wouldn't, and most people didn't understand the severity.
You didn't think
It's
it would
very
because
severe. What's happened
you
is
made
very
you
severe.
didn't make sure
But
to
I'd
keep
let you answer that. I assume
the
that
task
he
force that was
thinking
created
about
under the Obama
conduct of a
administration.
pandemic.
Thank you,
Idiot.
Mr. President. Absolutely. For 15 years now, this country has had a massive effort at the federal, state, and local level of preparedness for pandemic. Now, that largely has been, as I said in those remarks, about pandemic flu preparedness. We knew about SARS, we knew about MERS, which were earlier modifications or variants of the coronavirus. None of those achieved anything like what we're seeing today. But that's why for successive presidencies, including the leadership of President Trump, there has been a great focus on pandemic preparedness. In fact, it was just in November, I believe, that the president signed the Pandemic Flu Preparedness Executive Order that we have also updated the Pandemic Crisis Action Plan, which has been the playbook from which we've been working, the Pandemic Flu Plan, the action plan from which we have been working that coordinates the whole of government, whole of the economy approach here. So we've all been very focused on pandemic preparedness. That's what we do.
And yet,
but this
here we
particular
are.
strain of pandemic, who would have known this particular strain?
But Secretary Azar, if you were preparing for a pandemic, if this government were preparing for a pandemic, why is it we don't have enough masks? Why is it we don't have enough medical equipment in this country?
Previous administrations gave us very little ammunition for the military and very little shelf space. Let me just tell you, you know it. You know the answer. The previous
Well, no, your answer.
administration,
We don't necessarily know the answer, but your answer is going to be, it was
shelves were
Obama's
empty.
fault.
The shelves were empty. So what you should do is speak to the people from the previous administration.
Pass the buck.
and
I'm going
ask
to
them
pass
that
the
question.
buck whenever I
Because the
can. It's
shelves
not my
were empty. And you know what
responsibility.
else?
Nothing's
the
my
military shelves were
responsibility.
also empty. We had no ammunition, literally. That was
We had
said by
no.
one of your favorite generals. We have no ammunition. Guess what? We had very little medical supply also. All right.
I want to see that fact
We'll get
checked.
it back. We'll get you back. We'll get you back, please.
What about that question?
Jim, I said we'll get you back. Please, go ahead.
I wanted to ask about the DPA. So you said that there will be a ban on exporting of all, what does it cover? So masks, gloves, what else is
Covers
included in that
everything.
order? And are you...
But if somebody ordered, if Italy, if Spain, who has big problems, these are countries with tremendous problems, France, if they have long-term orders and they're in there and they want to get certain things, I've let them go out in certain instances because I think it's only fair. They have problems that are proportionately or relatively bigger than our problems. So if they ordered something and they're waiting for, as an example, masks made here and going to Italy, I'm not going to be stopping that. I think it would be very unfair. And by the way, speaking about being fair and unfair, two very big cruise liners, as you know, I allowed them to dock today. We worked with the governor of Florida, as you know, Ron DeSantis, and we worked on it, and we had tremendous security. And we
The
took
best security. It's
sick
tremendous.
people, and we're working
Best
with them.
security.
We have doctors. We have great doctors, military doctors. And from a humane standpoint, not that we're in love with this. These are two massive ships, but we have to take care of people. We have to take care. We sent many back to Canada. The Canadians came and worked very closely with us, as did the UK. We had a lot of people from the UK, and we took care of the Americans. We took care of the sick. We had some people very sick. I think we had 3 to 4, maybe 5 people that had died on the boat, one of the boats actually, and we had to take care of these people. So we could have let them float aimlessly into the ocean looking for port, as they've been doing for a long time. And I made the decision we had to take them in, and Homeland Security and a lot of other people did a great job. But we had to help people. These are people that were very, very sick. Some were dying, some died. Please. Go ahead, go ahead.
Mr. President, your staff today said that people in close proximity to you and the Vice President will get a coronavirus test. I'm wondering, are you concerned that the people you've been hanging around with may have the virus?
No, I'm not concerned, no. I had a test
I'm not
yesterday.
concerned.
For the
Took
order
a
of
test,
people
passed
who
it, got a
meet with you,
65.
Why
I don't know. I
should
mean,
they request
I
that?
heard from the oil executives, these are people, most of them had not had the test. And frankly, I think they left the room feeling good about a lot of things, but they felt good about the test. This was a test that took, I guess, 13 minutes to have it finalized. They took the test. I don't know. I didn't know they were doing that. Maybe they did it just for them. I don't know. But it seems that a lot of people, because now we have tests that really work well, Abbott, in this case Abbott, we have other tests being developed right now that are also fantastic. The original tests, the ones we inherited, Jim, as an example, they were broken, they were obsolete, they were not good tests, and that's what we got stuck with. We've developed some incredible tests, but this took 13 to 15 minutes, and they were all fine. Go ahead, finish your question.
The problem some people have raised is that if the U.S. stops exporting, what you could have is other countries then deciding reciprocally that they are going to stop exporting, and then the result of that then will be a net decrease in the amount of supplies that American doctors, American hospitals have. How do you address that?
Well, I address it in the following manner. We really are very well supplied. We're
very well supplied, except for
principal. It's the hospitals, the states.
We were left without anything from the previous administration, but we're very well supplied.
This happens, but nobody could ever have assumed that something like this happened. So we started supplying. We brought tremendous amounts to New York today, and over the last few days, we brought them to Louisiana. We brought them to Michigan. We brought them to Los Angeles. A lot of equipment. You read the amount of masks that we had. I think I said over 8 million masks.
8 billion.
N95 masks. The more expensive, more complicated, better, whatever masks.
Better, whatever.
Want to use in the hospitals. We have millions of them now, and we've given them to a lot. We sent to Bellevue in New York today. That was from Mayor de Blasio. 200,000 of them. But we have 8.1 million. We're going to have more than that. And we're getting them from various sources, including the military. We're rapidly then replacing them because we have to replace them in case there's another emergency. I would be gowns too. We have many gowns being delivered and have been delivered. Our people
they're the best hospital gowns.
Incredible job. Most people have said now, and I said this yesterday.
They close all the way in the back.
Thank you very much. Great job. If they're a Democrat governor, in some cases, not in all cases at all. If I said, here's 1,000 ventilators, how many do you want? We want 1,000. Here's 1,000. You got them. But you know what we're going to do? We're going to add another 5,000. Is that good? They said, wow, that's great.
I'm sure that's not what happened.
Jim goes and says, are you happy with the president? No, he should have given us 10,000. That's what's happening. You know why? Because that's a standard political answer. And that's a shame. Because we have done a job like nobody's ever done a job. But we've just delivered a lot of masks.
People are so unfair to me.
Gowns and protective gear. But you're talking about a massive number. But as of this morning, people were very, very happy. Steve?
Will executives ask you for a bailout?
No, they didn't ask for a bailout.
Ask for?
It was really more of a discussion than asking. We did discuss the concept of tariffs. Because, as you know, this was a dispute among a couple of countries that I think they want to be able to get it solved. They had a dispute. They had a competition, but they want to get it resolved. Russia and Saudi Arabia, I think they want to get it. Yeah, I think they want to get it resolved. I think they're working very hard. I mean, they told me they want to get it resolved. They're working very hard. Go ahead.
Thank you. Yesterday, Jared Kushner said the notion of the federal stockpile was it's supposed to be our stockpile. It's not supposed to be state stockpiles that they then use. What did he mean by our?
What are you asking?
And given the fact that taxpayers...
What are you doing asking a reasonable question?
No, it's not Russia.
Our, you know what our means? United States of America. That's what it means. It means
the state.
Our. It means the United States of America. And then we take that our and we distribute it to the states. Not that we have.
It's not supposed to be state stockpiles that they then
because we need it for the government and we need it for the federal government. But when the states are in to also keep
it's not to the state.
To keep for our country because the federal government needs.
It's for our states. It's not for the states. It's for the country.
We oftentimes choose, as an example, we have almost 10,000 ventilators, and we are ready to rock with those ventilators. We're going to bring them to various areas of the country that need them. But when he says our, he's talking about our country. He's talking. He's talking about the federal government. I mean, it's such a basic, simple question, and you try and make it sound so bad.
It was bad.
You ought to be ashamed of yourself.
You ought to be ashamed of yourself.
It's such a simple question. He said our, and our means for the country, and our means for the states because the states are a part of the country. Don't make it sound bad. Don't
was
make
terrible.
It so bad. Go ahead, Steve. Go ahead, back here. You just asked your question. You just asked your question in a very nasty tone.
Oh, Jesus, here we go.
Let's
Nasty tone. You're a nasty woman.
Mr. President,
I gave you a perfect answer. You know it.
A perfect answer.
just to follow up on that, when we have the federal stockpile, I mean, isn't that designed to be able to distribute to the states?
Sure, but it's also needed for the federal government. We have a federal stockpile, and they have state stockpiles. And frankly, they were many
It just
of the
contradicted
totally
himself
unprepared
again.
for this. So we had to
This
go into the
buffoon
federal
is just
stockpile.
inept.
But we're not an ordering clerk. They have to have for themselves. Now, some of the states were in good shape. Some of the states were not in good shape. That's probably something you could expect. We have been helping states. We have been spending a tremendous amount of time, effort, and billions and billions of dollars.
Trump, we're just the
on making
SA,
sure
not the
that they
USA.
have
We're
what
not the
they
United
have.
States
I mean,
of
take New
America.
York.
We're
We
just the
built them
States of
hospitals.
America.
We built them 4 hospitals, built them medical centers, sent a ship with 1,000 rooms and 12 operating rooms, and then on top of that, gave vast numbers of ventilators and vast numbers of surgical gowns, equipment, masks, everything else. Now, they had a chance to order ventilators over the years. They had a chance to order a very big, but they didn't choose to do it. We were there and we helped
The federal
them.
government's
And I think the
responsibility to
governor of New
protect
York
the
is
entire
very
nation from
thankful
things
for the
like
help that
this.
we gave.
You
But
dumbass.
we have a stockpile. It's a federal stockpile. We can use that for states or we can use it for ourselves.
Ourselves?
We
Who
use
are
it for the federal
ourselves?
government. We have a very big federal government. Go ahead.
Decided not to use your powers to be essentially a traffic cop for all the essential medical supplies that are
We're
needed.
not a
in there.
traffic cop. We're a humanitarian cop. We help. It's like the ships. Do you think we wanted to take 2 big ships into our country that have obvious problems, and you know the problems I'm talking about?
Yes, a good president
Do I
would
have a
want to
decision
take those
to make?
ships in and help
Do I
those
take 'em
people,
in,
you
or
stupid.
do I save lives? Okay? Do I take them in, or do I say, I decided to take them in? And we
Shouldn't have been a decision. You should have been like, yes, let's get them in. Let's do it safely.
They had 4
Let's
or
not
5 people that
dilly-dally.
died.
Let's get these
That
people
was
into
as of
safety
last night.
and not on these
They died
frickin'
in the ships. We
virus
took care of them.
incubators.
And now the people are in the process
How
of,
can
and
you
many
still
are
support
already
this
back
idiot?
in Canada, they're back in the UK, United Kingdom, and many of them were American citizens. Some were very sick. We're taking care of the sick people. We're testing all of the others very, very carefully. Very, very carefully. They are being tested like you wouldn't believe. And
They're
we
the best
solve a
tests.
humanitarian catastrophe.
They're
You know why?
fantastic.
Because
Beautiful
nobody else
tests.
would take the ships. Nobody else would take them. So we docked them in, I think, Fort Lauderdale.
Why you don't say we're the federal government and there's a shortage of masks
We do
and
say
other
that.
things, and we're going.
We do say that. We say, and we use the act. Excuse me. We do say that, and we use the act, and we've used it a number of times very powerfully, and a lot of times we don't have to use it because we say we're going to use it if you don't do this or that. And then we also have companies that act incredibly well. We have plenty of them, mostly them, but we've used the act very powerfully. And a lot of times you
How
don't
do you
have to
use an act
exercise the act.
powerfully?
All you have to do is tell them, look, if you don't do this, we're going to use the act. And we've done a good job with it, maybe a great job. Yeah.
Mr. President, there are news reports that you want to sign the stimulus checks that are going out here in several months. Is that right? Do you want to sign those checks?
Me sign? No. There's millions of checks. I'm going to sign them? No. It's a Trump administration initiative, but do I want to sign them? No. The people are getting
Federal
the people are
government
getting their money.
initiative.
There's a lot of stimulus going in a lot of different ways.
You just want to
There's
have your
also stimulus
signature
going for
on the
companies
check.
that
That's what he should have
were
asked.
for
Are you going to
government.
have your signature
And
on the
some companies
checks?
that were very strong a month ago. Again, we had the strongest economy in the world.
Who cares about
We
the
had
fact that we have
our
the strongest
best
economy?
ever.
You're
We
worrying
had
about the
probably
virus
the
right
best
now.
economy in the history of the world, bigger than China, bigger than anybody. And one day we have to say, close it up, stop. Everybody go home. And you know what? It's pretty tough to do that.
The rumors that these checks may not go out for another 4 months. Like if you don't
I
have
don't
the
know.
direct
All I can
deposit-
tell you is the small business today is that we're way ahead of schedule. There is a problem which I pointed out. I said you shouldn't do it this way with unemployment. We're 40-year-old equipment by the states. We're sending the money to the states. Once the money is sent to the states, then the states whether they're Republican or Democrat, have to get the money out to the people. Hopefully they'll be able to do it. But many of those states have 40-year-old computers.
We're not talking about unemployment.
I
We're
wanted to
talking
give the money direct, if
about-
that's what you're talking about. I wanted to give the money out direct. It would have been much easier. But the Democrats and some people
It's not
said,
much
no,
easier.
let's do it the complicated way.
More about the stimulus check.
Exactly.
All right, well, I was
When will
talking
people
about,
get their
excuse me,
money?
I was talking about both. Yeah,
When
they'll
will
get
people
it.
get their
They will.
money?
Go ahead, please.
Of course we're
Thank
talking
you, sir.
about
I'd like
those.
to ask questions both for myself and some of the other reporters who aren't in the room, social distancing. First of all, and this is for yourself and Dr. Burks, what percentage of the population do we suspect to be asymptomatic at this point? Is there a way to figure that out? Seems like the antibody test might be able to assist in determining that number.
Yeah, thank you. So while we're working diligently in the midst of the crisis to make sure that the healthcare workers and everyone who is sick gets provided for, at the same time we're working on tests and assays that will be critical for surveillance. And at the same time working on plans for what we need to do as this moves through the population and we get on the downside, which we're not
The only
there
reason
yet.
Donald Trump thinks everybody has a
And
scarf is
hopefully most of
because
the states will say,
she
like
has
California and
always wearing a
Washington.
scarf.
And
She
then
probably
what
thinks
we
that
need to
everybody has
do
a
to be
scarf
prepared
because
for
she has
fall.
a scarf.
So all three of those things are happening simultaneously, and there's people working on each one of those work streams. The antibody piece is critical, as you described, because at this time, we can't, if we have, let's say asymptomatic status is inversely related to age. And so the younger you are, the more likely you are to be asymptomatic. We have to know that because we have to know how many people have actually become infected. So when we talked about 5 days ago, I think on Monday, I called on universities to work on an ELISA-based test to test for their health workers and really get through that. At the same time, the private sector is working on tests. And what do we want those tests to be? We want those tests to be like what we use for HIV and malaria. Finger prick onto a cassette, you get a line if you're positive, and you get a control line. Negative, the line isn't there, and there's the control line. That's our dream assay because it's a finger prick. In the meantime, we're not waiting. I mean, we're pushing for that. At the same time, we're asking to develop an assay, the ELISA-based assay, which requires a tube of blood. And that's why we're also talking about, could we use dried blood spots? We also put out a call directly out to the military because of the Roosevelt to really test all of the sailors on the Roosevelt with an antibody test.
It's just ridiculous that that captain was fired.
Issue of asymptomatic.
He's looking out for his
and
crew,
already
and they fire him for
antibody. That would be if the first responders knew they already had it and they had protective antibody. If the nurses knew, the doctors knew. If your school teacher knew, then it's a very different dialogue. So we understand the importance of that, and we understand how important it is in relationship to understanding this epidemic. One other comment, because I know we're always saying who knew what when. I just want to make clear, there's 150 plus countries working on this collectively together. It's devastating for every single country. When we get through this, we can go back and look at what happened, where, and what does this epidemic look like. And when you get through it, then you can validate every model there is known to man. When you're in the middle of it, you have to concentrate on serving the needs of each American and what that need looks like. At the same time, you have these other work streams on surveillance and how to be prepared both scientifically and therapeutically and vaccine-wise for the next fall if it happens again. So I think these things are happening together, but I just want us to really concentrate on the fact that all around the globe, country after country is dealing with this. And we can talk about why didn't Italy do something, or Spain do something, or Germany do something, or we can really say right now, we all can do something. We can do the social distancing and all of the pieces that we know is starting to work around the globe in country after country. And then when we get through all of this, we can ask the questions about, could we have done some piece of this better as a global community? I will remind you that on February 3rd, the head of the WHO said there was no reason to ever do a travel ban. You know, it wasn't until January 14th that we knew that there was human-to-human transmission.
The President was saying this was going to go away. It's April.
It was going to be a miracle.
Mr. President, you said it was going to go away in April. You said when it warmed up in April.
I said it's going away.
It's going to be a miracle. One day it'll just go away like a miracle. Here we go.
Good answer to your question. No more. That was a long but a very good answer. That was enough for you.
Insurance coverage. Mr. President, on the insurance coverage for treatment, when your government is trying to make sure that people are covered on the treatment,
we're going to do that.
Does that include the 11 million people who are in this country illegally?
Oh,
Are
jeez.
they going to be covered as well?
We'll be talking about that at a different time. Yeah, please.
I'm not ready to answer that.
Authorize the release of the underlying data for the conclusion of the 100,000 to 240,000 people succumbing. Perhaps Dr. Birx can
Well, that's up to
talk
Dr. Birx. You'll decide.
We can release all of them.
These experts have expressed concern that they haven't seen the underlying data. They're not
I'm sure they'll
questioning-
talk to you about that, and Dr. Fauci too. Please, go ahead.
Thank you, Mr. President. This is for you and Secretary Azar. 10 million people say they've lost their jobs in the past 2 weeks. So how is this stimulus money for free treatment going to absorb the new numbers of uninsured? And would it not be easier to reopen the Obamacare markets or expand Medicaid?
Well, if you lose your job, it's automatically
for an
open for
individual
you.
who had employer insurance, that's what I mentioned in my remarks. If you were employed and had insurance through your employer, and you've now lost your job and lost that insurance, you now do have
qualifying
a special
event.
enrollment period where you may enroll in the individual exchanges of the Affordable Care Act. So that's existing law. Then what we're doing is taking from that $100 billion to providers, taking money and saying, if you're a provider and you care for anybody who's uninsured, we're going to compensate you for doing that. And we're going to compensate you at the Medicare reimbursement rates, and you are not allowed to bill that uninsured individual anything. So in many respects, it's better for those uninsured individuals. They're going to get first dollar coverage.
For
They're
this
going to
stuff,
get
anything.
care in
This
the United States.
related to
and the provider's
COVID-19,
gonna be
not
made
for
whole from this program.
other
So it's
things,
really
like if you get a broken leg.
unprecedented. What President Trump is doing here with this money is an unprecedented disease-specific support of care for individuals to make sure that people get treatment.
Of course, we had a better
So we
system
build it
that
competitive
Trump
bid,
fights,
or what about
trying to dismantle the
non-competitive
system go the old way, we'd all be screwed.
Specifically on New York and the question of ventilators. Governor Cuomo is saying that New York may be days away from running out of ventilators. Can you
That face,
assure
like,
New York
so what?
that going into next week?
I don't care about New York, they're not going to vote for me anyway.
No, they should have had more ventilators at the time. They should have had more ventilators. They were totally underserviced. We are we're doing our best for New York. You know, we have
Passing the
we have
buck.
states. We have a lot of states.
He will never take personal responsibility for anything. Nothing. That is a problem with conservatives. Conservatives never, a lot of conservatives, I should say, never want to take personal responsibility for things that they do that are wrong. Because to apologize for something is a sign of weakness to them. Talked about this on my show. It's ridiculous.
We have a big problem in Louisiana. We have a big problem in Michigan. We have a big problem in 7 other really strong hotspots. But we're doing the best we can. I wish they did the original orders 3 years ago. They would have had all the ventilators they needed.
Done it 3 years
Although
ago.
even then they wouldn't, because if you look at what the original request was from New York, it was far greater than anybody ever heard. And we've supplied a lot. I told you.
Federal government has responsibility because you don't know where it's going to hit first. So why would New York buy them if you don't know? That's why you have a
Did you have one in the back? Yeah, please.
combined purchasing power of the
That
nation.
was asked earlier is so important.
I don't think that was a question.
No, it was a very important question because what Jared Kushner said yesterday is that the federal stockpile is for use by the federal government, not for the states to have access to. So you seem to be saying different. So did Jared Kushner misspeak yesterday?
No, he
is
didn't.
that federal
He didn't misspeak.
stockpile?
He's my son-in-law.
Okay, our is referring to our country. The
He's
states,
such a
to
liar.
the best of my knowledge, to the best
You're
of my
lying
knowledge,
right
are
now.
part of our country.
Like
we are
ting,
taking
and the little
what
thing
is
that
in
goes
the
just
federal stockpile,
ting
and we are
whenever
helping states
a
all
lie
over the country.
happens.
But we also want to keep some because when that surge comes, when you hit those peaks, we're going to need, we have to be able to have the flexibility to take those ventilators and bring them to Louisiana, New York, Detroit, different places, that's all.
We will be using
But the
it for
word,
states that
oh, of
need it.
course. we're
That's
not
why
using
it's not the
them
state's
anywhere else.
responsibility to have it,
We're
because
not
the
gonna
federal
be using
government needs to be the one
anywhere else.
that
But
determines
we want the
where it's needed
flexibility,
at any
because,
given
we don't
time.
even know when the surge
He
is
doesn't even
coming,
realize how
but
he's
it's coming
contradicting
soon and it's gonna
himself.
be big.
So
And
stupid.
some areas won't have it. Some areas will be pleasantly surprised, just like we've been. You look at the chart. States that I thought would have been maybe a disaster turned out to be, really, they've done a great job. Some states are really trouble. But you don't know.
Right
You
here,
don't
River
know.
City.
We have great
With
flexibility.
the capital C.
I would have preferred giving them all out.
Capital
We have
T and that
nothing.
riser
And now
C,
when
that
we have
stands
a
for
surge,
Corona.
we can't get them back
Oh, we
from
got
where
trouble.
we gave them, because it's very
We got trouble
tough
right
to take
here.
them back. So we have tremendous flexibility. And it could be New York, it could be Louisiana. Those are two that are really rough. New Jersey is very rough. And they've done a very good job in New Jersey, but New Jersey is very rough. Go ahead, please, Nabet.
Yes, the question is about the CDC guidelines. I know that they've changed over time from February, and
The guidelines relative to which? The
for
masks?
instance, social distancing and the number of people who can gather in a group and so on. And now we have this measure about wearing masks. And I know you told Steve about why you don't want to wear a mask, but I'm just wondering if you can tell us more about why, because it was
I just don't choose
an
to.
example.
They're not mandatory guidelines. They're guidelines. They suggest you could wear them, you don't have to wear them.
Set the example.
In fact,
They're
the
saying
director
it
is
can
here if you
help
wanna
if
say a
you're
couple of words about it.
asymptomatic
You can
and you
if
have the
you don't
virus.
have to.
Wearing a mask
But
protects other
basically,
people, and
it's a
you don't want to do
voluntary
that because
thing.
you're a
Thank
selfish
you.
piece of
Done a
crap.
good job.
Thank you very much. I think I just want to reemphasize, I've said this before, that we're not defenseless against this virus. We have a powerful tool, a powerful weapon, that is social distancing. And we've continued to embrace that with the President's initiatives to slow the spread of coronavirus.
President's
We're constantly
initiative.
looking
President's
at new
initiative.
data. And as the
Federal
Surgeon
government's
General said,
initiative.
one of the
The
new
CDC's
information
initiative.
that became more clear to
The
all of us
experts' initiative.
is there's a greater number of
Donald
people
Trump
that
probably
are
would have never had us
asymptomatically
do
infected
social
than
distancing
previously
if he had his
thought.
druthers.
As Ambassador Birch said,
He would have
that may be
said,
in
we
part
can't
due to
shut, we
age.
need to go to work.
And so really the purpose here
We can't shut
is
these
first and
businesses
foremost
down,
embrace
let them all die.
the social distancing.
That's
the
what Donald
number
Trump would
one
have
thing.
wanted.
That's the powerful weapon. And you know, this virus has a great weakness. It can't jump from one person to another if it's got to swim more than 6 feet. And this is why we really want that. That said, we now know that there may be individuals in areas of significant community transmission that may be asymptomatically infected.
We've known that
and
for a little bit
we know
now.
that a face barrier can actually interrupt the number of virus particles that can go from one person to the other. So
And
as was
as
said
such,
by
the
Vice
president should be setting the
this is-
example.
and the purpose of this face covering is to be another adjunctive mitigation strategy to protect
Those words are too
someone
large
from
for
spreading
Trump.
the virus from themselves
Or any of the
to someone
deplorables.
And I was just tested also, so.
Doesn't matter.
I assume I don't have the virus, so I don't have to worry about spreading it. Okay? Please.
Do you wash your hands
President, I
too?
want to make sure we're clear. When you mentioned tariffs earlier that came up in the meeting, are you considering tariffs on Saudi Arabian oil? And
Well,
then
I can
also,
always consider, look, tariffs have made a tremendous amount of money for our country. I put them on China, I put them on other places, and other countries tariff us, and they take advantage of us, and they have for many years. Look, countries have taken advantage of the United States for years. They've ripped us off like nobody can even believe, whether it be on manufacturing, whether it be on exporting.
Probably ripped
whether it
you
be
off
almost
because you're an
anything,
inept
including
business
military,
person.
where we provide virtually free military assistance to countries that, frankly, take advantage of us, don't even like us, okay? So this has been going on for years. They tariff us. They create artificial, you could say non-financial barriers, which are worse than financial barriers. You can't sell your product. You can't take care of our farmers. They won't take and yet they'll take us and sell into us. And we won't charge them anything for doing it. Look, they've taken advantage of us for years. Tariffs are a way of evening the score. Tariffs are a way of just neutralizing. They have tariffs on us, and we now can put tariffs on them. Am I using it for oil? It's something we can. No. Am I doing it now? No. Am I thinking about imposing it as of this moment? No. But if we're not treated fairly, it's certainly a tool in the toolbox.
and what about with Russia? Would you consider maybe lifting sanctions?
I would never
Getting
do anything
sanctions
bad with
on
Russia
Iran?
because I'm
No,
Putin's
it'd be
bitch.
the same thing. They are having a dispute, the two countries, and it's hurting the rest of the world because it's really hurting the energy industry. Russia's being hurt unbelievably badly, and Saudi Arabia is being hurt unbelievably badly. Because oil and gas is a primary, that's where they get most of their income. And this is a price like from the 1950s. All right? It's a price from the 1950s. They are being hurt very badly. I think they're going to settle their dispute pretty quickly.
Why, on the oil, why do you think
Mr. President,
raise the price? Why do you think you haven't been more successful in getting them to increase production in Russia and Saudi Arabia?
Well, they have increased production. That's what they've done. They've increased it so much that there's, so you meant the opposite.
Why do you think you haven't been successful?
Well, they're going to stop because the market, ultimately the market is going to get them to stop. But they both did the opposite. They increased production to a level that water is right now more valuable than oil. Who would have ever thought, right?
Who would have ever thought?
You go to some of these kingdoms, water is far more valuable than oil. There's so much oil. It's a tribute in a way. But what happened is there was a lot to start off with, and then you had the virus, and it knocked the hell out of the market in terms of demand. So there's no demand, and there's tremendous supply.
Which means prices go down.
I mean, you saw numbers where it was down to 20,
it works.
and down, frankly, below 20.
But so these people love capitalism until it works against them.
Market, but ultimately, the market.
So it's not capitalism if you're going to interfere with
I
supply.
think they can work out their problem fairly quickly. Okay, go ahead.
Mr. President, thank you, Mr. President. We're already talking about phase 4 of a stimulus, right? But you and Pelosi and McConnell are already talking about different things that should be in it. Now, last time, people were telling me that the fact that you wouldn't talk to Pelosi was an impediment, and it really slowed things down. Are you?
I'd talk. If it were important to talk to her, I'd talk to her. If it
were
were important for the American
to talk to
people,
why isn't it important to talk to her now about the things that
American
American people need?
Talking to her.
So petty.
Look, you ready? Infrastructure is a great thing for me. I think infrastructure for this country, we have an old broken infrastructure. 50 years ago, we were the envy of the world. And then we spent all this money so stupidly in the Middle East. It's going to be very close to $8 trillion in the Middle East. How stupid was that decision? But they spent it on that and other things. We've got to fix our infrastructure. That means roads, highways, tunnels, airports, everything.
I could agree with that.
And the beauty is because of the fact that we are so strong as a country, we're borrowing at zero. We never had a chance to borrow at zero. Even this country, we never had a chance to borrow at zero. We're going to borrow. This is a great time. So we can fix our infrastructure, and we'll have almost no interest costs. This is the time to do it. Steve, one more question.
The death toll projection that you shared with us earlier this week, are we still on the current trajectory for that, or have social...
Which one? I have many trajectories for many things.
100 to 240,000. Are we still on that trajectory, or have we made any improvements, or maybe not enough time has passed?
Say it.
The trajectory on the virus, dumbass.
On the models? I'd have to ask Dr. Fauci, and I'd have to ask Deborah. Have the models changed?
So a lot of the projections you
How
can
could you not
see
understand
are
the
based
context
on,
of that?
there's many different ways to look at this.
Question.
And as
Again,
we discussed
dumb.
on Sunday, some of it is based on the current global experience. We're about, I think, 6.5 or 5.5 times the size of Italy, a different factor in Spain, and we look at all of those, what their projections are, where they are currently, and where that is going. And so a lot of the work is based on how this virus has moved through other populations. That's a very direct way to see how the virus is impacting a population. There's also terrific models. And so every day and every night,
sorry, it's not Trump talking. I'm sorry, I'm not used to hearing somebody else saying terrific.
To mortality is the healthdata.org data. And they
Are those tiny microphones to make
and
Trump feel bigger?
Where we are in that projection. I think in the last run of that model, they were at 93,000 or something in the model. Now, all of that can be changed by our behaviors. And so, and all of it can be changed in a different way if we don't follow those behaviors. If another major metropolitan area ends up having an epidemic like the New York metro area, that could dramatically change not the model, but the reality of the impact of this virus on Americans.
Now, by the way, the models show hundreds of thousands of people are going to die, you know what I want to do? I want to come way under the models. The professionals did the models. I was never involved in a model. But
I think he's been involved in several models, but
you know what?
they probably had to pay them off too.
Thousands of people. They say, I want much less than that. I want none, but it's too late for that. But I want very few people relevant
Hence looks
to
miserable.
what the models are saying. Those are projections. I hope they're wrong. I hope we're going to be under those projections.
Two questions on continuity of government.
How come you always have two? Why can't you have one?
Well, they're related.
Every time. I have three questions. I have two questions. Can you give me one instead? Because you have a couple of other people. Go ahead.
Okay, I'll go with my second one. The governor of Wisconsin is now talking about delaying the primary, or at least not having in-person voting. So my question is, and I asked this a couple weeks ago, I want to see if you've made any progress on this. Looking ahead to the fall, are you taking steps to ensure that the general election will happen even if this pandemic has reemerged or hasn't gone away?
The general election will happen on November 3rd. In Wisconsin, what happened is I, through social media, put out a very strong endorsement of a Republican conservative judge who's an excellent, brilliant judge. He's a justice. And I hear what happened is his poll numbers went through the roof. And because of that, I think they delayed the election.
Concerned about people going to in-person voting?
I don't know. Why didn't he do it before? He's doing it right before the election.
But do you think
Excuse me. Why did he do this 2 weeks ago? All of a sudden, all of a sudden an election which is taking place very soon gets delayed. Now, I just endorsed him
Several
today,
elections have been
and it was a very strong endorsement
because of the virus.
He's gone very high up, and all of a sudden the governor comes out, the Democrat governor, by the way, comes out and says, oh, we're going to move this election. So I don't know. I hope you're right.
But do you think every state in this country should be prepared for mail-in voting?
No,
in case we're in
because
a
I think
situation?
a lot of people cheat with mail-in voting. I think people should vote with ID,
What
voter
do you
ID. I
base
think voter
that?
ID is very important, and the reason they don't want voter ID is because they intend to cheat. When you get
That's
something,
not
when you
true.
buy something,
The reason you
look at
oppose
your
voter ID
cards
laws,
and
I
credit
could
cards
talk
and
about this
different cards. You have your
forever.
picture on many
Go to
of
my
them, not
website,
all
I have
of
a
them,
thing
but
on
many of
that.
them. You should have a picture on your for voting. It should be called voter ID. They should have that. And it shouldn't be mail-in, it shouldn't be mail-in voting. It should be you go to a booth and you proudly display yourself. You don't send it in the mail where people pick up all sorts of bad things can happen. By the time they sign that, if they sign that, by the time it gets in and is tabulated. No, it shouldn't be mailed in. You should vote at the booth, and you should have voter ID. Because when you have voter ID, that's the real deal. Thank you very much. We'll see you tomorrow.
It's ridiculous it's turning to voter ID. It's crazy. I can go into that. The voter ID laws that are passed, the so-called voter ID laws, have non-ID provisions that disenfranchise people, and that's why they want to pass these voter ID laws. Not because of the voter ID, but because of these other provisions that make it less likely for people to be able to vote. And whenever I bring this up, and I've talked about this on my podcast too, where I predicted, I said, look, these people are going to say X, Y, and Z. And they're going to say, why don't you want voter ID? What problem do you have with voter ID? It's not the voter ID that's the problem. It's the other issues. But other than that, you're registered already. So if you're registered to vote, you should be able to get a ballot and mail it in simply because of the fact that, guess what? You don't want to spread this virus. You don't want to spread this virus and using elections to spread the virus. It's
your face,
being
your
safe
money maker
is the most important thing in this election. So the fact that he brought it up to voter ID is just ridiculous. And you should be able to go in person and be proudly display yourself. Well, guess what? Some people can't do that. And if they're sick, they should be able to not go infect other people if that's still a problem by that time. And instead, they should be able to mail in a ballot. And we could make it so that it's secure. But no, these people don't want to do that because they know that less people voting means they win more often. And that's what this is all about. Republicans win by disenfranchising voters by making sure that less people can vote. And again, I'll talk about this more on my podcast again on Wednesday because obviously now it's now an issue again. But I'll bring it up again like I brought it up before because there's so many so much incorrect information about these things, especially with the fact that I can tell people, I can go into a conversation right now about voter ID laws, and I could sit there and I could say, I don't have a problem with the voter ID. It's the non-ID provisions in the law that I have a problem with. And guess what? They'll say, what's wrong with requiring an ID? I'll even tell them in the conversation, I bet you that in response to this thing, you're going to ask me what's wrong with requiring an ID, even though I told you that my problem was with the non-ID provisions. And they'll still ask me that same question because they're programmed to talk about it. It's just in their head that's just the way that they've been told that the Democrats have a problem with voter IDs, because if you put a voter ID thing, if you had something like Mexico where everybody got a card, a national ID card, and they could go use that to vote, nobody would oppose that. But North Carolina wanted to charge money for it. North Carolina took these voter ID laws and they researched non-ID provisions like methods of voting, and they say, okay, they took all of the ones that black voters used and they got rid of those methods of voting specifically. They specifically targeted how black people vote, got rid of those, left in the ways how white people vote, making it harder for black people to vote, making them have to do things that they never had to do before, because they don't want black people voting, because when higher black turnout means more likely the Democrats are going to win. But I'll talk about them more on the podcast. Tune in. Might have one or more of these as well. 8 p.m. Wednesday night, blogtalkradio.com/liberaldan. You can also follow me at liberaldanradio on Twitter. So, till the next time, stay healthy.